Good afternoon, class. My name is Joseph Lamond, and today I'm here to talk to you about injuries that commonly occur in the sport of wrestling. The three we're going to be talking about are shoulder dislocation, ankle sprain, and elbow tendonitis. So the first thing we're going to do is discuss the MOI and anatomical significance and issues that are occurring with a shoulder dislocation. There's two types. The first being anterior, which is the most common, and posterior dislocations. And the mechanism of injury for wrestling is commonly occurs from someone either landing on it, which will typically happen will create an anterior dislocation, or getting taken down, someone landing on the shoulder. Getting pulled. A lot of times in wrestling, your arm will get pulled behind your back. Someone pulls on it real hard. That can also cause it as well. The main worry with shoulder dislocations, 40 to 50% will result in surgery down the road. There's a high reoccurrence of injury with shoulder dislocations. So the rehab. First let's talk about the treatment. It can have, the first thing you're going to do is immobilize the shoulder, putting it in a swath sling, not letting the shoulder relax. If it's still out of place when they come see you, there are ways in which you can reset the shoulder. If you didn't see it and it's been a while, get them to a emergency room right away, have them shoot an x-ray, an MRI. That would be part of the treatment. You want to make sure there's no fractured bones, the scapula, the acromion process, the clavicle, all those things are in such a tight area. Fracture rate is rather high as well, so you want to make sure there's no broken bones in that area. You check for, it's called crepitus, so any movement of bone, you hear it move. But if you can, reset the shoulder there. You're going to tell them to RICE method, rest, ice, compression, elevation. We said x-ray and MRI. And you're also going to want to refer them to, if the x-ray or MRI is positive, you're going to want to refer them to an orthopedic surgeon. So for the rehabilitation, something I always tell all my guys when they come in, when I see patients for shoulder injuries, we do Thrower's 10. It's incredibly underused, but you're going to hit every exercise for the rotator cuff to strengthen the area, and also strengthen even though you're working out the muscles, stronger muscles equals stronger tendons, and it's going to keep the joint in place better. So Thrower's 10 is a series of 10 exercises utilized very commonly by professional baseball players, and it's going to be in every direction the shoulder moves. So up, down, or flexion extension, coming up at the angle, externally and internally, up and down, okay? And you're going to have them do, it's called Thrower's 10, so you're going to do 10 reps. And so I'm going to have my wife come in and she's going to demonstrate these exercises, okay? And the progression would be without weight, what's comfortable, okay? So she's going to go and stand here, and the one we're going to demonstrate is just coming up at the oblique, okay? And you would have them use either a free weight or the cables at the gym, the cable weights, okay? So she's going to start here, okay, keeping her arm straight, and she's going to move up, okay, and then down. So if you're using the cables, she would be pulling down the cables this way and then coming back up, or vice versa. She would have the cable here and coming up. She would be using this. She would do it 10 times in both directions, so pulling this way and pulling down. The next one is also a dowel rod stretch. So dowel rod stretches, we're also going to talk about with the elbow tendonitis. And basically all that is, you can also use a towel for it, okay? The whole goal is to make rehab and preventative medicine easy for your clients or patients. So you can start with a towel or a dowel rod, and you'll come up, and then you should be able to go over. I would have a longer towel, and then it'll go back and then over, and vice versa. You can pull the shoulder down, and you can pull the shoulder up, or the arm up, which would stretch out the shoulder. Okay? And then the third one we're going to talk about, going to step right here, is just one. So the Throwers 10 is 10 exercises. Okay? So the next one we'll do is the medially, internally and externally rotating the shoulder. So she's going to keep her elbow tight in, okay, and she'd be using a cable, pulling out and doing 10 reps of that, and then vice versa. Cable would be here, and you pull in. Initially, like I said, they're only going to be using no weight. Once they feel comfortable and the range of motion is there, then you would add the weight. All right, so now the next injury we're going to be talking about is a sprained ankle. So there's 3 grades of sprained ankle. You have grade 1, 2, and 3. 3 being complete tear of the affected ligament. It'd be very loose, and then 1 being stretch or a minor tear of the ligament. The ligaments we're mainly concerned with or that are most commonly injured are the anterior talofibular ligament and the CFL, the calcaneofibular ligament. So the most common one is going to be an inverted ankle sprain, okay? And the treatment would be wrap, which we discussed last week, wrap or a brace. And for all 3 of these injuries, you'd want to give them ibuprofen too, 600 to 800 milligrams 2 times a day. You don't want them to exceed extreme doses, and none of us have medical licenses to prescribe medicine, so you can suggest, but obviously we're not going to be prescribing them medicine. But it's always, anytime people come see me, I tell them take ibuprofen, but that's because my job allows me to. You're going to want to rest, ice compression, and elevate. And same thing, X-ray, MRI. And for the rehab of the ankle, rehab and preventative care, we're going to do calf raises and a towel stretch and drawing the alphabet with your foot. Okay, so we'll go ahead and demonstrate those right now. So for the calf raises, I'm going to have my wife stand right here. All right, and she's going to face the wall. Okay, so for the calf raises, you're going to start, once again, without weight and progress with weight after the ankle feels better and they're able to bear weight on the ankle. So she's going to extend up, heels coming off the ground, and back down. Okay, and that's one set. And you can also do these with one leg. So she can lift one leg off and lift up and down. Okay, but we don't do that until their ankle is completely stable. They're able to put weight on it. They're going to do 2 to 4 sets of 10 reps every day for 4 weeks, and I highly recommend continuing it. Okay, so she can demonstrate that 1 or 2 more times. Up and down. Excellent. Okay, and now I'm going to have her sit down. Okay. She's going to do a calf towel stretch. So she's going to put her left leg out. Okay. And you're going to have a towel just like we have here. And she's going to dorsiflex her foot. Put it around. And she's going to pull and stretch out her calf. Okay. And then she's going to relax. She's going to do 2 sets of 40, meaning hold it for 40 seconds, or depending on the severity, pulling on it 40 times. You can do this every day for 4 weeks. Once again, even though you may be healed after those 4 weeks, it's a great preventative measure. And then the last one is going to be to draw the alphabet with your foot. So I'm going to take the towel back. You're going to face the camera. And then with one of your feet, you're going to just draw an A. with the ankle, just with the ankle. Yep, and it might look a little weird, but you're going to utilize all your range of motion for your ankle. And they're just going to complete the entire set. Once they get stronger, they can always add like a little 2-pound weight at the end, or maybe ankle weight, and just put it at the bottom of the foot. Okay? Alright, so now we're going to move on to the elbow tendonitis. I'm going to reposition the camera here. This is our fitness room, by the way, if you can't tell, if you weren't able to tell. A lot of fitness goes on in here. Alright, so the mechanism of injury for elbow tendonitis, it's really an overuse injury. It's inflammation of your tendons. It can happen in any tendon, but in wrestling, like I said, you're getting wrenched every way. It's a very common occurrence. So the treatment's going to be the same thing: MRI, X-ray, because our job as athletic trainers, as doctors, whatever our field is, we have to rule out worst case scenarios and rule out other differential diagnoses. So MRI, rest, ice, compression, elevation, brace, wraps, educate them on our proper warm-up. Same thing with the dowel rod or the towel stretching, and ibuprofen. In the military, we call it vitamin M. And for rehab, the most important thing for overuse injuries is proper stretching, especially in the case of tendonitis. Okay? So even though it's part of the treatment, we're also going to use it as rehab. Really stretching before you work out or perform exercise. And especially in the sport of wrestling, most injuries occur during practice, and not necessarily because the match is so short. It's a 6-minute match. Sometimes you may have 5 in a day, but that still equates to 30 minutes. So most of the injuries will happen during practice, so it's very, very important to warm up prior to it. You're going to want to strengthen up the tendons and your tricep muscle. Okay, so you're going to do elbow extensions. Okay, you can go up. You can have a dumbbell lifting up, or cable pull downs. And you can also use a lacrosse ball or some type of foam roller and roll the area gently and gradually increasing the pressure you put. With all these exercises, rehab is going to always be dependent on patient/client comfort. We never push them too quickly, but we also don't want them to become complacent. So with that being said, those are the 3 injuries and how we would treat them, how we would rehab. I appreciate your time and have a good day.